Shoot. Давай, Sark.
I'm gonna knock the door, identify my patient, identify myself. I provide privacy, wash my hands, and explain to the patient what I'm gonna do. It's a head-to-toe assessment. I'm gonna check for the patient's orientation, ask where they are, what brought them to the hospital, what year or month is that, and I'm gonna go ahead and check, take the vitals, blood pressure, pulse, respiration, oxygen, and ask for pain. I record all those, and I'm gonna start checking from the head. I'm gonna palpate their scalp, check for any lumps, scars, and see hairs, patterns, and I'm gonna ask if they had experienced any dizziness or headache, and I'm gonna look at the face for skin color and symmetry. I'm gonna ask the patient raise their eyes to check their cranial nerve 7. I look at their eyes. I'm gonna ask to raise eyebrow and check their eyes. Yeah. And I'm gonna use my pin light to check if her patient's eye is reacted to the light, both round, equal, and reacted to the light, and if their pupil dilates when they look forward and to the pin light, and I would go ahead and check, ask if they have any history of the surgery in their eyes or any vision problem, and I would go ahead and check their nares, no drainage, breathing okay, and then I would go ahead and check patient's ears, no drainage, look good, and would ask history of the ear hearing, or they have hearing loss or anything like that, ringing in their ears if they're experiencing, and I would go ahead and ask the patient to smile, see both sides symmetry, and they're raising well at the same time, and I would check the patient's mouth, open your mouth, I would check for the loose teeth, membrane, mucosal membrane, and check their buccal, no patches, no irritation. Please stick your tongue out, and I'm gonna go ahead and check the patient's neck, trachea in symmetry, lymph nodes are not swollen. I will check the carotid arteries, bilateral, and I would go ahead and check the patient's skin for elasticity, and then their torso, if they're, sit up, please. If their breathing rate and speed and intensity, if it's labored or no, and I would also check their lungs, auscultate their lung. This is my stethoscope. Breathe in. For any crackle sound or wheezing, ask if they had any allergies or in and out, any asthma, infection in their lungs, any respiratory illness in the past or surgery, and then I would check the posterior side of their lungs as well. Breathe in, out, in, out. I auscultate the patient's lungs bilateral, and now I'm gonna go ahead and check the 5 heart sounds: aortic sound, tricuspid sound, pulmonary, earth point, and then mitral. And I would check the apical pulse for 1 minute. And I would ask the patient for any cardiovascular issues in the past or experience any chest pain, high cholesterol, and I also would just then check the abdomen part. It would be then checking the skin, and then check both quadrants, and I would start with osculating, checking the sounds, if they're hyperactive or hyperactive. I'm gonna start with the lower right quadrant. And then I would palpate lightly to see for if there's spasm or any abnormalities. And then I would ask the patient when they went to the bathroom last time, their diet, any history of intestinal problems, swallowing, or digestion. And I would go ahead and check their patient's upper extremity. And I would check their their skin, range of motion, squeeze my hand, and resistance. I would check the resistance both sides at the same time. And I would check their brachial pulse bilateral, if they had good perfusion. And I would check their nails, shape, and perfusion by capillary refill, less than 3 seconds per good perfusion, more than 3 seconds is not. And I would ask for any surgery or any thing in the past. And then I would go ahead and check the lower extremities. Can you push my hand? Check the range of motion. Push to my hand. Push, and then I would check the nails.
I mean a mosquito. And then I ordered a mosquito killer
to make sure. Just can you go away, please?
Oh,
Video pulse. Almost done. And then I would go ahead and check the skin, hair growth, any pain. I would ask in joints, any history of fall. Then I would check the femoral pulse and posterior tibial pulse, and I would also check for edema. There is no edema, not swelling legs, and I would go ahead and check genital part, see if there is no drainage, the color is okay on the skin, no irritation, and I would ask the mode of illumination, there's no catheter, asking for burning, stabbing, or any pain during voiding, or they had any surgery or anything in the past. Then I would go ahead and check their psychological behavior, ask if they had depression or mood swings or anything, neurological issues. And then I would remove my gloves, and I would document and follow up based on my finding.